A new Rutgers health study is raising serious questions about the influence of social media on young people's drinking habits. The research, a meta analysis published in The Lancet Public Health, found that teens and young adults who see alcohol promotions in their social media feeds are significantly more likely to drink or binge drink compared to those who don't. Now, the findings come from 31 studies representing more than 62,000 participants and highlighting how digital marketing can subtly normalize alcohol use for younger audiences. If you see it all the time, you see people, whoa, having a good time, you think that's just fine. What's the big deal? It is a drug. A liquid drug, it is a drug. Dr. Scott Donaldson is assistant professor of general internal medicine at Rutgers Robert Wood Johnson Medical School and one of the lead authors of this important study. Good morning to you, Dr. Donaldson.
It's great to be here, Ken. Thanks for having me on the
Good to have
show.
you on. And I speak as a person. I don't drink alcohol. I don't smoke. I don't do drugs. I'm one of those guys. It wasn't that I said I'm not going to drink because I'm choosing to be moral. I have atrial fibrillation. That's aside. I tell you that because the minute I gave up my 2 to 3 martini a day 10 years ago, my whole life changed for the better. I think we are just drowned with, if I could use that term, with these ads, making it look like
Mhm.
it's a classy thing to drink and it's fun. And the social media ads are everywhere for alcohol, especially this time of year. So, what did your team discover about that connection between the marketing and what is actually happening, especially in young people?
When teens see alcohol in their social media posts, they're more likely to drink regularly, and binge drink. This effect was consistent across 60,000 young people across the globe. So, a striking finding, Ken.
That is a huge number, and it just takes the idea of having that occasional glass of wine when you're out to dinner, which is perfectly fine, and it turns it on its head because now you're saying that this is something that it's good, it's encouraged, it's a party. You're cool if you get drunk or stoned or whatever, and that is exactly the antithesis of what we want young people to know. So your study now shows that those exposed to alcohol-related content were what, up to twice as likely to drink or binge drink. So are these like paid ads or influencers? What kind of video are we talking about?
Yeah, content from commercial companies. Those could be paid ads, exposure to branded accounts on social media that young people might follow. And that also is encompassing the new and emerging trend of social media influencers, which
And
we're
it's
hoping to
not even
study in the
about.
future.
I'm sorry to step on you, doctor. This you
That's
found
okay.
that what it wasn't even about how long they're watching, but if it's like a certain influencer who might come on, that it's more important, if you will, from the alcohol company perspective, to get that message out really fast. So it doesn't even matter if they're watching a long time. Is that true?
Right. So in the study, with the studies that we analyze asked participants if they had ever seen this kind of content. So the literature and the science is yet to get into those specifics of the dose and the effect, which we assume might be large. But for this study, I just looked at all the studies that had ever been done on this topic and summarized them. And the vast majority of the researchers asked these young people, have you ever seen this kind of content? And that was associated with a 2 times increase in susceptibility to use or intention to use alcohol, using alcohol, and binge drinking outcomes.
I remember I worked for a TV station in Miami back in 1998, 99. And I remember that's when Red Bull first came out. And this is not to single out any particular product, but the big thing was to do vodka and Red Bull. And the way it was promoted, they literally came into nightclubs and were giving away vodka, Red Bull, vodka, and they would sell it as the vodka makes you sleepy, but the Red Bull wakes you up so you can keep drinking. And they had, I remember, an incidence of ambulances, one ambulance after another on the strip on South Beach in Miami, because these kids were drinking 10, 12 drinks to the point of almost alcohol poisoning. They were passing out because they weren't feeling it, because they were getting up, all this. So they were like caffeine poisoning and alcohol poisoning all rolled into one. It's amazing the power of influence like that and what it does. Now, in this case, you found that this was especially strong among adolescents. So why among them? Is it because they have not experienced the sickness of hangovers, or is it because they just are more susceptible to social media marketing?
I think they're more susceptible to social media marketing. They're Gen Z young populations that are digital natives. So the phone is all they know. Whereas you would go to a sponsored event out in the real world and see Red Bull and vodka for a few hours. The phone's in their pocket 24/7. So those exposures, we don't know they could be getting hours of this kind of content. And it's problematic. So we're
Mm,
encouraging parents to talk to their kids about this phenomena. We're asking policymakers to ban this kind of problematic content, and then also, calling on the public health community to design programs and interventions that equip kids with the skills they need to handle the digital environment and know what they're looking at.
it's really unnerving. And what I mean, what is the conversation that parents need to have when they sit down with their kids? What should they say?
I think it starts with a simple conversation of, what are you looking at online? What kind of content are you seeing? A lot of times with this type of marketing, it's covert. It's hard to know what, you're being targeted with. So I think it starts with a simple conversation between parent and child or teen. Um, just having a discussion about marketing and what, kind of content they may be exposed to inadvertently.
Yeah. Doctor, what is the website that you have there for more information?
ScottDonaldsonPhD.com.
Right. Dr. Scott Donaldson, Assistant Professor of General Internal Medicine at Rutgers Robert Wood Johnson Medical School. We thank you for coming on this morning. Very important topic.
Thank you for having me on the show, Ken. Great to be
You
here.
bet. Appreciate it.